Gilbert joined our team a little over a year ago. It used to be that the well residents would get to go on outings and excursions, and Gilbert doesn't see it that way. He sees absolutely everybody in that long-term care as deserving of some fun, some social engaging experiences.
I always grew up that every person is part of the community, and I like to get them involved and do things and make them feel part of the community, and I like to see them laugh.
I help families to acknowledge their strengths and reclaim their resiliency so that they can advocate for themselves and get their needs met.
A child that's been in our clinic for quite a while. Mom is very socially vulnerable. She's not from this country. She was having trouble taking care of that child on her own because she was a single person. So she decided to send the child back where she'd have family to help her. Lisa worked really hard to try and find funds so that that child's medication and food could be covered. Very sad that that child passed away of her seizure disorder. And even though she wasn't our patient anymore, Lisa took several days to help that mom make the phone calls and fill out the paperwork so that she could have closure.
I can't think of anyone better in this building than Nicolette Day for social justice. One of her residents was sent to the ER for a procedure. So the resident's daughter actually phoned Nicolette Day and was extremely upset as to the condition that her loved one was enduring at the hospital. So she got in her vehicle and she drove to the hospital to advocate on the resident's behalf.
I don't have any great philosophy in life except that you do what's right, you don't do what's wrong.
Sarah takes control, she calms things down. She listens, but she hears. She helps as much as possible. She's the staff champion. She makes sure they know all their options, the changes that are happening.
As an HR advisor, I'm in a unique role. I never know who's going to be coming to my door with what type of problem or what type of concern. So my first thing is always just to listen and to give them the opportunity to be heard and to have that voice. And then I can take that and I can advocate for people.
Sheila is part of the speech and language team. So Sheila was involved with this young gentleman who had Guillain-Barré. She has seen him right from the beginning, from where all he could do was eye movement to eventually using a laser pointer to using a communication board.
She has implemented technologies and strategies to help these patients. It decreases their frustration levels, it improves their quality of life, improves their overall care.